We are just hours away from the President's Health Care Summit, and here now with his expectations for the meeting, Congressman Eric Cantor, Minority Whip, who will be in attendance. He joins us here on set in the nation's capital. Congressman, great to see you back.
Good to be here,
Good morning. I was saying to you during the break, I wasn't sure if expectations could be any lower for the meeting. The President's called it his opening bid, but I guess the question is, who's he bidding with? Is it Republicans or members of his own party?
You know, Carl, it really shouldn't be about Republicans or Democrats right now. This health care battle really is about the American people. And it's interesting to look at where we've been over the last year. I mean, the people have spoken out again and again. The town hall meetings that we saw in this country, the election after election, I think the people have now decided they don't like this plan. So when we go in there today...
But they want a plan.
There's no question. I think that everybody wants to try and improve the status quo in health care. I mean, Republicans are going today because we do care about health care. We want to make it better for people, and we want to bring down costs. We just don't care for the President's bill. So I'm hopeful we'll hear some backtracking, if you will, by the President to say, hey, it's time for us to really get off of this bill and try and begin a way and a path that we can improve health care for folks.
When you say backtracking, what would impress you in terms of something offensive on their part to reach a compromise? What would get your attention?
What would get my attention is, I think what the people of this country are looking for is an admission by the President that he's actually hearing what people are saying.
That is, the bill's too big.
That is, the bill is unacceptable, and the bill doesn't work. And so if we could hear the President say that I hear you. Maybe our intentions are good, it's just the way we're doing it doesn't convince, nor can it convince the American people that that's the way. So we're willing to now go ahead, start over, and look at ways to do a more modest step-by-step approach to trying to bring down costs right now. That's where people's heads are. That's what they need for their health care right now.
So if the White House comes in today and says, all right, all your ideas on tort reform, they're in, but we still want to cover as many people, and we still want the spending package to be as much. Not enough.
No, again, it is the bill itself. I think the American people rightfully have decided that it cannot accomplish the goals in a sustainable way. And that's the problem. It's not a workable bill. If you care about people's health care, right now what we need to do is to focus on the cost issue so that we can have people continue to receive the health care that they like, not take it away from them and have Washington decide what's best for them.
Do you think this is, I mean, it's been called a kabuki dance. It's been called a 6-hour photo op in the past 24 hours. Does that explain your views? Does that illustrate your view of what this is today?
Carl, whether it's a kabuki dance, a press opportunity, whatever, it is an occasion for us to go in and to see whether the President and his party are willing to listen to the American people. That's been a stunning thing to me over the course of the last several months. How is it that this White House can continue to ignore what the public is saying?
You mean how is it that this bill is still alive? It was called Rasputin the other day, the old monk who was poisoned and shot and just kept on living.
The amazing thing, though, is, you know, the President and his party have extraordinary power here in this town, and it really is the beauty of American democracy that has stopped this bill from passing. They don't need Republican votes. They control both houses here and obviously have the White House. So something, to me, should strike this White House to say, enough, let's stop and let's really begin anew and try and address the quality issues and the cost issues in a sustainable way.
Well, clearly they wouldn't be pressing so hard on this if they didn't think, if their vote count didn't make them comfortable. You're one of the best vote counters in the city. Where do they stand right now on the House side?
Right now on the House side, Carl, Speaker Pelosi does not have the votes. You know, there's a lot of talk in this town about inevitability, that they're going to use the reconciliation process to jam this thing through the Senate at a 50-vote threshold. The problem is they still need 218 votes in the House, and they don't have them.
What do they need? How far are they down?
I think if you look at sort of the issues that are out there, they are down significantly. They could be down 15 to 20 votes.
Really?
Yes.
So easily, definitely double digits.
Yes, and as each day goes by, I think that the moderate Democrats are hearing from their constituents that reflect most of this country that doesn't like this bill.
Joe, that's more than we heard yesterday.
I know. We get a guy like Cantor. You're down there, Eric. and I know you hear scuttlebutt, and I'm just trying to figure out, I like gossip, and I want to know what's going on in the halls of power there. You got a smart, savvy guy like Rahm Emanuel, who seems to kind of get it, right? And it looks like Axelrod wins out and has the president's ear, and he decides to go with him. Is it ideological fervor that the country just doesn't understand what's good for it in terms of going ahead with this? What do you think they're thinking? Or is it, let's give it one more shot with this. The Republicans look kind of bad in that you were there. You weren't standing at a podium cutting people off. You didn't look nearly as good as the president at that last meeting. Is that what this is? One last try to get this ideological idea through after 70 years, the Holy Grail?
Yeah, Joe, I hope it's not, but it sure seems the case that the president nor the speaker want to give up on this attempt to really, really transform the health care that we know in this country. But what I think is going on is people understand that things may sound good. I mean, recently the president came out and said, we're going to put in place a new regulator here in Washington to make sure there aren't excessive premium increases. You know, that's great. Nobody wants their premiums to go up. But you can't magically go and say it's going to happen. I think the American people understand that, and they're very doubtful now that the results that are promised can be delivered. That's why we should start over.
Is it that, or they want a skinnier plan? And would you be in favor of a skinnier plan like Rahm Emanuel has proposed?
Becky, a skinnier plan really is going to be tested in the details of that plan. It's how they do it.
A lot's been written about personal chemistry in the Congress. Evan Bayh says you guys don't hang out socially. The president didn't know Jeb Hensarling's name in Baltimore. Do you like him? Do you guys even know each other?
Well, Carl, I've been in several meetings with the president. I've had dinner with the president.
But is that part of the problem, do you think?
There's certainly an air here of lack of working together. Sure. I mean, that's the political nature of this town. I do think that there could have been a lot more inclusion of both sides in getting to where we are today. We'd probably be a lot better off, and so would the American people, and that's what it's all about.
People talk a lot about Reagan and Tip O'Neill and even Clinton Gingrich in contrast to today's environment. We'll all be watching and appreciate you stopping by in advance.
Carl, it's good to be here.
Eric Cantor.